Hi, everybody, and thank you for watching On Call for All Kids. Today, we're going to be talking about everything you need to know about teething. We'll be going over the difference between a teething and sick baby, how to comfort a baby while they're teething, and things we should not use on a teething baby. I'm joined by Dr. Rachel Dawkins. She's the medical director of the Pediatric and Adolescent Medicine Clinic at Johns Hopkins All-Children's Hospital. And it's great to see you, Dr. Dawkins, and it is not fun when you have a teething baby.
That's true. So there's nothing worse than a teething baby in the middle of the night. We definitely know that.
How can we really identify whether or not that baby is sick or just truly teething and going through that phase?
Yeah, so all babies are different when teeth actually appear. So teething can happen anytime from 3 months old to 3 years old. Most babies do start teething around 4 months old. So when we think about teething, we think about drooling, the child's rubbing lots of things against their gums. They can be uncomfortable, maybe a little cranky at night. So those are all signs that a baby can be teething. It can definitely be confusing for a family because they're like, is my child sick? Maybe they have an elevated temperature and they associate that with teething. But typically, teething babies don't get true fever, so they don't get anything over 101. Teething can be associated with maybe a little runny nose, but typically they're not throwing up or having diarrhea or really having cold symptoms. So if your child's having those type of symptoms, they probably have a virus and it's not just teething.
Can you offer some tips and advice for parents on how can they comfort their baby during this time of teething?
Yeah, so parents can give their baby something that they can chew on but not choke on. So think about firm rubber toys, even a soft toothbrush, or my favorite thing is take a washcloth or rag, wet it, put it in the freezer, and then your child can gum on the cold rag. And that actually works out great. Some parents like to massage their finger along their child's gums, and that can actually relieve a lot of pain. And if all else fails, you can definitely give your child a dose of acetaminophen if they're in a lot of pain from their teething.
How about things we should avoid or, not be giving them? Is there anything we should be aware of?
Yeah, so I think there are lots of things out there that are marketed for teething, but are actually unsafe for babies. So one of them is products that contain benzocaine, such as baby Oragel or Ambisol or Orabase. These should not be used for teething. There's been rare but lethal side effects of using these medications. And so the FDA actually, for a time, removed them from the market so parents would know not to use them, but I have definitely seen them come back out. Other things such as some of the teething tablets you may see on the market, some of them contain belladonna, which wouldn't be great for kids. And then also, we see a lot of families use those amber necklaces to ward off teething pain. Just remember that those are both a choking and a strangulation hazard. So if you're going to use an amber necklace, make sure you're using it with supervision. I wouldn't leave it on your child while they're in bed or sleeping.
Alrighty, Dr. Dawkins, thank you so much. And thank you all for watching today. We certainly appreciate it and hope you learned a little bit. If there's anything you would like us to look into, a topic or speak to our doctors about, you can comment below right here on this video. And you can also visit our website. It's HopkinsAllChildren'sHospital.org/newsroom, and you'll find a lot of wonderful pediatric information there as well. Thanks for watching. We'll see you next week.